Hello everybody, my name is Hala Muaddi. I'm a general surgery resident at the University of Toronto, and I'm also pursuing a PhD in clinical epidemiology through the Clinician Investigator Program at the University of Toronto. We're interested in applying to the Dragon's Den for a project that we're quite passionate about for examining disparities in access to liver transplant and post-transplant outcomes in Ontario. Liver transplant is a life-saving procedure for patients with end-stage liver disease, where the deceased liver is replaced with a healthy liver free of disease. Recent evidence in other types of solid organ transplants suggested that there are marked disparities that exist at various stages in the transplantation process, including the referral, the evaluation, the receipt, and post-transplant outcomes. Socioeconomic status is the social standing or class of an individual. We believe that individuals of any social standing or socioeconomic status should have equal rights to access to liver transplant and optimal post-transplant outcomes. Currently, there is no available information on whether patients with different socioeconomic status requiring a transplant are served equally throughout the province. This information will help identify underserved patient population and will guide the development of future interventions and strategies to overcome inequalities in access in our province. Our study objective is therefore to evaluate whether patients' socioeconomic status contributes to disparities in access to liver transplant and post-transplant outcomes for patients that are over 18 years old with end-stage liver disease in Ontario. To answer this objective, we have identified three main questions. Question 1 is, are Ontario residents with end-stage liver disease and different socioeconomic status equally seen for a liver transplantation consult? So in other words, this means, are patients with a higher socioeconomic status more likely to be seen in consultation to be assessed for a liver transplant than patients with a lower socioeconomic status? Question number 2 is, once a patient is seen for a liver transplant consultation, are there socioeconomic disparities amongst patients that actually receive a liver transplant in Ontario? And question number 3 is, once a patient has received a liver transplant, are there differences in post-transplant outcomes of patients with different socioeconomic status in Ontario? And here we will also look at the differences between live and deceased organ transplantation. We plan to perform a population-based cohort study using administrative data sets containing demographic, diagnostic, procedural information on Ontario residents. Fortunately, all these data sets are housed and consolidated and linked in one place at ICS using a unique patient identifier. The benefit of these data sets is that it will allow us to follow the patients in time through all the treatments, interventions, and diagnoses with minimal loss of clinical information about the patients. Our team consists of a transplant surgeon, a transplant specialist, and ICS scientists with expertise in clinical epidemiology, biostatistics, and administrative databases, making the goal of this project achievable. This strong collaboration demonstrates the importance and the value of this work for its impact on improving patient care. The results of this study will have an important impact on clinicians, researchers, public health officials, policymakers, and most of all, patients living with end-stage liver disease in Ontario and beyond. We will identify whether socioeconomic status acts as a barrier to access of liver transplant and provide insights on how this affects post-transplant outcomes. This will help us address disparities and ensure equitable access to transplant and outcomes in our province. Thank you very much for your consideration.